Hey there, and welcome back to our channel. If you're looking for reliable health information, you've come to the right place. Today, we're diving into something super important for people managing diabetes, Lantus SoloStar. How does it work? Why do doctors recommend it? And how can it help you keep your blood sugar in check? Stick around because we'll cover everything you need to know. But before we jump in, make sure to hit that like button and subscribe for more expert insights. Let's get started. Lantus SoloStar is a long-acting basal insulin used to manage type 1 and type 2 diabetes. It contains insulin glargine, which helps control blood sugar levels for a full 24 hours, reducing the risk of highs and lows throughout the day. Unlike fast-acting insulin, which kicks in quickly, Lantus works slowly and steadily. Think of it like a slow-release energy source for your body, keeping your glucose levels stable between meals and overnight. So how does Lantus actually work? Once injected under the skin, it forms tiny microcrystals that slowly release insulin into the bloodstream. This provides a steady and predictable lowering of blood sugar throughout the day. Unlike some insulins that require multiple doses, most people only need one injection per day. And the best part, Lantus helps reduce nighttime blood sugar drops, a common concern for many patients. Using the Lantus SoloStar pen is simple and convenient. Here's how you do it. 1. Check the pen, make sure it's clear and free of particles. 2. Select your dose, turn the dial to the prescribed units. 3. Inject under the skin, usually in the abdomen, thigh, or upper arm. 4. Hold for 10 seconds, this ensures the full dose is absorbed. 5. Dispose of the needle safely, use a sharps container, and that's it, just 1 injection a day, easy, right? Now, like any medication, Lantus SoloStar has possible side effects, though not everyone experiences them. The most common one? Low blood sugar, hypoglycemia, so be sure to monitor your glucose levels regularly. Other possible effects include mild swelling or redness at the injection site, weight gain, common with all insulins, allergic reactions, rare but possible. Always follow your doctor's guidance and never mix Lantus with other insulins in the same syringe. So why do doctors recommend Lantus SoloStar? Once daily dosing for all-day control, lower risk of nighttime lows, proven to reduce A1C levels, easy-to-use pre-filled pen. For many people, it's a game changer in managing diabetes and staying active. And that's a wrap. If you found this video helpful, make sure to smash that like button, subscribe, and turn on the notification bell so you never miss our latest health tips. Have any questions about Lantus SoloStar? Drop them in the comments below, and let's chat. Thanks for watching. See you next time.